Today we will talk about a serious and important topic, the 7 signs and symptoms of throat cancer. We will try to convey to you the most useful information about the signs and symptoms of this disease so that you can pay attention to the alarm signals in time and take action. Throat cancer develops when cells in this area undergo mutations in their DNA, which causes them to grow uncontrollably and can lead to the formation of a tumor. Over time, these malignant cells can invade neighboring tissues and spread to other parts of the body. The throat itself is a muscular tube that begins behind the nose and ends at the neck. Throat cancer is a malignant neoplasm that develops in the pharynx, larynx, or tonsils. It is important to understand that throat cancer can manifest itself in different ways, depending on which part of the throat it develops. It is divided into several types. Laryngeal cancer occurs most often and affects the vocal cords, epiglottis, and subglottal area. Pharyngeal cancer is divided into nasopharyngeal, oropharyngeal, and hypopharyngeal cancers. Tonsil cancer affects the lymphoid tissue of the tonsils. Each type of throat cancer has its own characteristics and symptoms, which are important to know and be able to recognize. Survival statistics for throat cancer vary depending on the stage of the disease at the time of diagnosis. With early detection and timely treatment, the chances of a successful recovery are much higher. For example, with localized throat cancer, the 5-year survival rate is about 75–80%. However, if the cancer has already spread to the lymph nodes or other organs, these indicators decrease significantly. That's why it's so important to pay attention to the symptoms and contact a specialist on time. The purpose of this video is to give you, dear viewers, knowledge about the 7 key signs and symptoms of throat cancer. By recognizing these symptoms in time, you will be able to seek help in the early stages of the disease, which will significantly increase your chances of successful treatment. We will talk about each of these signs in detail, explain why they occur and how to recognize them. Take care of your health and do not ignore the signals of your body. 7. Cough. One of the most alarming signs that indicates throat cancer is a persistent cough. If the cough lasts for more than 2 weeks and you cannot find an explanation for it in the form of a cold or allergy, this is a serious cause for concern. Please note that a common cough with a cold or allergy usually resolves within a week or 2, especially with proper treatment. When a cough does not respond to treatment and lasts longer, it may be a symptom of a more serious illness. Throat cancer often causes irritation and inflammation of the tissues, which leads to a constant cough. Such a cough may be dry or accompanied by sputum, sometimes with an admixture of blood. This symptom is especially alarming if it disrupts your sleep or interferes with daily activities. After all, healthy sleep is a key component of our health, and when a cough interferes with sleep, it greatly affects overall well-being and immunity. Do not ignore the constant cough. Of course, not every prolonged cough indicates throat cancer, but it is better to be safe and contact a specialist for a more detailed examination. In folk medicine, there are remedies to alleviate cough and relieve inflammation, such as herbal infusions, honey, and propolis. However, remember that self-medication is not a substitute for professional medical diagnosis and treatment. 6. Voice changes. Another important symptom to pay attention to is voice changes. If you notice that your voice has become hoarse, this may be a wake-up call. Persistent hoarseness, which does not go away even after rest, requires special attention. Usually the voice may wheeze with a cold or after overexertion of the vocal cords, for example, after long conversations or loud singing. However, if hoarseness persists for no apparent reason, this is a reason to think. Constant hoarseness can be caused by a tumor that presses on the vocal cords or disrupts their normal functioning. We always pay attention to the condition of the voice as an indicator of overall health. Changes in the timbre, sound, or strength of the voice that do not go away over time may indicate problems with the larynx. If your voice does not sound the same as usual, and you notice that it lasts longer than usual, it is better to consult a doctor. Folk remedies can help temporarily soften the vocal cords and reduce inflammation. For example, warm drinks with honey and lemon, inhalations with herbs, or gargling with chamomile infusion. However, remember that such methods are good as support and do not replace a full-fledged medical examination. Voice changes are one of the symptoms that is often underestimated. But be attentive to your body, listen to its signals. If your voice has changed and is not returning to normal, do not postpone a visit to a specialist. 5. Problems with swallowing. The next symptom that is worth paying close attention to is problems with swallowing, or dysphagia. If you find it difficult to swallow, this may be a sign of serious changes in your body. Dysphagia is a medical term for difficulty swallowing. This condition can manifest as a feeling that food gets stuck in the throat or chest. Sometimes even simple swallowing of liquid can cause discomfort or pain. When you feel that food does not pass freely and gets stuck in the throat, this may be a symptom of a tumor in the larynx or pharynx. Cancerous growths can narrow the esophagus or larynx, preventing the normal process of swallowing. This condition is not only unpleasant but also dangerous, as it can lead to malnutrition and other serious problems. If you experience pain or discomfort when swallowing, do not ignore these sensations. The pain can be sharp or dull, constant or occurring only when swallowing. Such symptoms are often associated with inflammation or swelling that require medical intervention. There are methods that can temporarily alleviate the symptoms of dysphagia. Gargling with decoctions of herbs such as chamomile, calendula, or sage can help relieve inflammation and ease discomfort. Warm drinks with honey and soft, non-irritating food are also useful. However, it is important to understand that such remedies can only temporarily alleviate the condition, but will not solve the main problem. In case of persistent problems with swallowing, it is necessary to consult a doctor as soon as possible to diagnose and prescribe appropriate treatment. 4. Unexplained weight loss. Another important signal that requires your attention is unexplained weight loss. If you notice that you are losing weight without changing your diet or physical activity, this can be a serious sign of the disease. If your weight has started to decrease on its own, without increasing physical activity or changing your diet, this may be an alarming signal. The body loses weight when it spends more energy than it gets from food. It is important to note that these are not just some kilograms that can be explained by lifestyle changes, but a rapid and unintended weight loss that does not stop even with normal nutrition. Unexplained weight loss may be associated with other symptoms of throat cancer, such as difficulty swallowing or increased metabolism. Difficulty swallowing can lead to you becoming less interested in eating due to difficulty eating. Increased metabolism can also speed up the weight loss process. In both cases, weight loss can be a sign of serious health problems that require immediate intervention. Some herbal teas can help improve appetite and stimulate metabolism. However, with unexplained weight loss, especially in combination with other symptoms of throat cancer, self-medication can be dangerous. If you find that you are losing weight for no apparent reason, do not delay your visit to the doctor. Only a qualified specialist will be able to determine the cause of weight loss and prescribe appropriate treatment. Be attentive to your body's signals and take care of your health. 3. Enlarged lymph nodes. If you notice swollen lymph nodes in your neck, this may be a sign of a serious disorder in the body, especially if they do not go away after infection. Lymph nodes are a part of the body's immune system that helps fight infections and other diseases. When we have an infection, the lymph nodes can swell in response to the fight against pathogens. However, if the enlarged nodes on the neck do not go away for a long time, this may be an alarming sign. If the lymph nodes in the neck remain swollen and do not shrink even after the infection has passed, this may be a signal that something is wrong in the body. Tumors or other abnormalities can lead to enlarged lymph nodes, as they are part of a system that helps the body fight cancer cells and other abnormal structures. Enlarged lymph nodes, especially in the neck, may be one of the signs that the body is fighting cancer cells. The lymphatic system plays a key role in detecting and fighting cancer cells, and an enlargement of the lymph nodes may be its reaction to the presence of a tumor or other diseases. 2. Ear pain. If you have persistent unilateral ear pain unrelated to an ear infection, it may be a sign of more serious problems related to the throat area. The feeling of pain in one ear, which does not go away and persists for a long time, is an alarming symptom. Persistent unilateral ear pain may be an indication of problems in the throat area or even the presence of a tumor directly affecting the surrounding tissues and nerves. It is important to note that ear pain unrelated to an ear infection should not be ignored. An ear infection is often accompanied by other symptoms, such as discharge from the ear, itching or redness of the external auditory canal. If these signs are absent and the pain persists, it may indicate other causes, such as throat problems. Ear pain can be caused by the interconnection of nerves between the ear and throat. Different structures in the throat and ear area can be connected through nerves, so problems in the throat can cause a responsive ear pain and vice versa. For example, a tumor or inflammation in the throat can put pressure on the nerves, and this can cause pain in the ear. 1. Lump in throat or neck. A noticeable lump in the throat or neck is a symptom that cannot be ignored. If you find a noticeable lump, accidentally or during palpation, this may be a sign of a serious disorder in the body. A noticeable lump in the throat or neck can cause anxiety and anxiety. You may accidentally detect it by passing your hand over your neck or throat, or feel it when palpating. This may be a symptom that requires immediate attention. A noticeable lump in the throat or neck can have various causes, including swollen lymph nodes or even the presence of tumors in the throat area. Lymph nodes may swell in response to infection or other diseases, but if the node remains enlarged or continues to grow, it may be a sign of more serious problems. Neoplasms in the throat can also manifest as noticeable lumps or bumps. A noticeable lump in the throat or neck is a clear sign that further examination is needed. Regardless of what may be the cause of this lump, it is important to consult a doctor to diagnose and identify possible problems. Early detection and treatment of any abnormalities can save lives. Early detection of signs of throat cancer is crucial for successful treatment. Each symptom that we have described today may be the key to early detection of the disease and maintaining your health. Knowing about the symptoms and listening to your body is the first step to fighting throat cancer. If you experience suspicious symptoms, do not hesitate to seek medical help. Your concern for your health can save your life. Thank you for watching this video. Your support is invaluable to us and allows us to continue to provide important medical information to everyone who needs it. Not signed yet? Now is the right time to join our community. We strive to share health tips, medical knowledge, and wellness strategies that will help you lead a better life. In addition, the subscription ensures that you will not miss our latest content, created to keep you up to date and expand your capabilities. Join us and keep up to date with all the most important things. If you have any questions or need additional information, ask questions in the comments. Thank you for your attention and taking care of your health. See you soon.